Here we are. Here we are. Hi, everybody. I'm trying something different this time. I'm actually using like semi-professional equipment. Can you hear me? Please, somebody tell me. Please give me the peace of mind to know if you can hear me right now. You can. Oh, I'm so happy. Okay, thank you. Thank you all. And that probably sounds better because I'm using an actual microphone this time around. And the the HD camera, which shows how tired I am at all times. But we say tired, but it's just I'm 36 years old. I look like I'm in my 40s. I swear I do. And don't tell me I don't. Okay, that's okay. I'm aging as gracefully as I possibly can, considering I've had a cardiac arrest and cancer twice. I'm doing the best I can, everybody. But thank you for being here. Welcome to What the Hell Wednesday on a Thursday. I couldn't get it together. I'm sorry. The thing is, I'm on call, and I'm going to talk about what on call means for me as an ophthalmologist here shortly. But it just wasn't happening yesterday. So fortunately, this is a fly by the seat of your pants operation. And so we're going to take it as it comes, everybody. And so thank you for being here. Hello to the Glock flock. Welcome. It's good to see you all again. I'm seeing your comments and your handles. I'm just looking at my face right now, but I'm so glad you're here. Just a quick update on our group, on our flock, which I love. By the way, I love it. The Glock flock. It's great. Um, we are up to about like 419,000 subscribers since November. Since November, I'm blown away, and I love the vibe. I love the that you all bring to the replies to my videos. I can't tell you how much I appreciate it. It really is a wonderful thing. I love doing this. And it's because of all you that I do these lives. I love doing these lives. This is really fun for me. So thanks again for being here. So I'm going to talk about being on call because I just started a week of call. A week. That's what we do. So I take call a week at a time. And so I'm in private practice. I'm a private practice ophthalmologist, and I have no right to complain about call. I really do. There's a call is relative. All right. It's right now. It feels bad because I got to do things, but in reality, compared to what it has been in the past and what other people in medicine go through, it's good call. It's fine. It's totally fine. It's 3 weeks, 3 to 4 weeks out of the year. We cover four community hospitals. So they're small hospitals in the Portland area, Portland, Oregon, and but we cover a lot of patients. We have a very large practice, and so it ends up being a lot of phone calls, a lot of patients calling in, needing advice and things like that. The emergency departments do a pretty good job, actually. They all you emergency doctors, shout out to you guys. And I'm just saying that. I'm not just saying that to fight off the call evil that you can very easily curse yourself with if you're not careful. You guys do a great job in emergency medicine. But when I say call is relative, I still remember in residency, um, uh, and I remember in residency, I did my residency at University of Iowa, which is a large level one trauma center. Call was crazy busy. It was really busy. I would frequently, it was like every fourth night, basically fourth or fifth night, and it would be constant. And there would be very frequently I would be up all night seeing patients with eye problems. I have nightmares of seeing the ED board that's just eye problem, eye problem, eye problem, over and over again. You guys, it's bad. And so you'd be up all night, but then the thing is, with ophthalmology call, a lot of times you have to be in clinic functioning as if you have slept all night. You have to be in clinic all day the next day. So it ends up being a really difficult, like 24 to 36 hours that you're constantly working and thinking and practicing medicine. And that could be a whole nother conversation of whether or not it should be like that. We got a couple. I got somebody here. Send a. Oh, thank you, X7. I appreciate. Thank you for being you, and I'll continue to be me. I appreciate that. And Megan Smith, I appreciate. I love the whatever that is. Looks like some kind of fox or something kissing a heart, eating it. I don't know. Eating? Is it eating a heart? It doesn't matter. I appreciate the heart. Thank you. And so, but the reason I'm telling you about my Iowa call, the way it was in residency, is because when I graduated residency and I got to this private practice job, it was like a breath of fresh air. It was like, I can't believe this is actually call. Like I get paid to like this is really this is all it is. Well, like a few weeks a year, you barely have to go in, and so that was about 4 years ago when I started at this job, and but now 4 years later, it's you just get used to the new normal. So now if I have to wake up at like 2 o'clock in the morning and just sit up at the edge of the bed and talk to someone, I'm like, oh, I need to find another job. This is horrible. And so it's hard to remember sometimes what things used to be like, how bad things used to be. So I try to remind myself about that, so I don't complain about it in YouTube lives like this, and then I get to hear about it from all the current residents and interns who are not sleeping at all, ever. And so it kind of it would make me look kind of stupid to do that, right? So anyway, so call. I'm currently in a week of call. Hopefully, I can get through this live without getting paged. If not, I'll just have to answer the page with all of you guys on here. You guys can help me. You want to help me on ophthalmology? How much do you know about eyeballs? Nothing, I'm sure, but that's okay. That's all right. We get through it. We get through it. All right. How we doing? You got. Oh, thanks, Baines 10127. You got me. I appreciate that. Thank you. I love seeing all you guys. Thank you for being here. I don't know what time it is where you are. It's 7 o'clock, obviously here, and on the West Coast. And so, thank you. If you're up late, go to bed. It's not that important, really. You can go. Oh, this will be up later. Don't worry, you'll be able to watch it later. There's something about it happening live that you want to be there for it. But seriously, go to bed, go to sleep. All right, you need your sleep. It's so important. All right. I also want to talk about a video I put out a couple days ago. Before we get into that, a couple other little things. Danielle, thank you. Thank you so much for people keep posting this little rabbit, the chipmunk slash squirrel thing. I appreciate that. Thank you. And Timothy Davis, everybody say hi and congratulations to Timothy Davis. He just took step one today. Well done. I'm sure you crushed it. I'm sure you went out. You know what? I bet all of the Prometric staff are just they're talking about you, Timothy. Did you hear about Timothy Davis? He came in here, just absolutely destroyed this test. They're going to be talking about you for weeks because they have nothing better to do at Prometric. That and frisk people all day. So congratulations, Timothy. I'm so proud of you. Well done. And Sir Billiam is a second year med student. Thank you for the kind words. I'm glad I could give you a laugh. All right, so I put out this video about academics, about publishing in academics. Hopefully, all of you have gotten a chance to see it. I just found out today, a couple people told me that it was trending on Reddit. It was on the front page of Reddit, whatever you call it. I don't go to Reddit very often. I don't have an account on Reddit. But every time one of my videos pops up on the front page of Reddit, people tell me about it. So it must be some kind of a deal. And apparently they didn't like tag me in it. I don't know how they would. I guess linking it to my YouTube video account or whatever. But you know, I just like it getting out there. That's fine. It's always great to attribute content to the actual creator whenever you post something, even across platforms. You know, I always try to do that. And so it's just a good practice to get into. But anyway, that's cool. So thanks. If all any of you are on Reddit, you know, let me know whenever that happens. I think that's pretty cool. I'll have to go and find it and read the comments and you know, hear about it from people. All right. So anyway, what I was going to say is I posted that video on academic. Those of you who are not in academics, so let me give you a caveat here. I am not in academics. I am not research oriented. Just looking at an Excel spreadsheet makes me want to throw up a little bit. I'm getting nauseous right now just talking about it. It's not my area of expertise. But one thing I like to do with my comment is I see the areas in medicine that where there's conflict or there's people being taken advantage of. I like to shine a light at those little things that are sometimes they're overlooked. People don't think about it. We just think about it as normal. Like we think about it as normal uh, that academic journals won't pay for the content that they publish. They don't really contribute monetarily at all to the research that is done. Yet they enjoy enormous profits, you guys. Enormous. It's crazy. Billions and billions of dollars. These journals, and there's like a handful of really big ones, like Elsevier and some of the other ones. I don't know. I don't even know what they are. But anyway, they're huge corporations, and they reap so much benefit from researchers who are they don't make a lot of money doing it, and they're making incredible discoveries, and they're contributing new knowledge. That's hard to do. That's and it's just so impressive what they do, and it kills me that they're not receiving, I think, the type of benefits that they should. Now, people can argue with me about whether or not they should be paid for the research or for the publication. I don't know. I'll leave that up to the people that are actually in academics and can speak more eloquently about it. But I wanted to shine a light on that, and uh, it's just and the responses were interesting. Let me make sure I haven't missed anybody. Oh, Dewan. Oh, hi. I was talking to you earlier on the chat. Thank you. Thank you so much. The response, a lot of the responses to that video, I thought were really interesting. Some people, enjoyed the comedy aspect of it. It's like a brand of video that I'll do, which is more sadness. It's like 50% just why is life like this? 50%, oh, that's kind of funny. And that percentage will vary based on who's watching it. But some of the it kind of made me sad, some of the comments, because it was like this people are like, this is my life. Like I can't, like, people, I almost started to feel bad that I was talking about this because people really felt taken advantage of. People had no idea that it was set up this way. And it really it made me realize, just reminded me how valuable your time is. Like all of you, all of us, our time is so valuable. And having had that cardiac arrest about a year ago, I'm reminded about this relatively frequently, and I've been better about you know managing my time and not giving my time away to things that I don't want to give it away to. And I encourage all of you to think that way because your time has value. It has monetary value. And if you want to do something just because you want to do it, great. If you don't want to, if you're going to do something just because someone asks you to, but you don't really want to do it, don't do it. Or at least get paid to do it. I mean, that's sometimes you can't, but it's just keep that, remember that your time has value. Okay? I just, you know, I have, especially over the past 2 years, I've just been better at saying no to things that either it's going to be kind of a hassle, or there are other things I'd rather do. And if what you'd rather do is sit on the couch and watch Netflix, do it. You say no to the thing that you can put on your resume, and instead do the Netflix thing. If it's going to bring you more happiness, do it. All right. Anyway, that's just like something I've just been constantly thinking about for like the last 2 days. Um, I haven't even been paying attention to the chat. You guys care about this? Is this, I don't even know. Whenever I'm talking about some of these subjects, I just let the chat go, and then I'll look back and just hope nobody's making fun of me. All right. I assume because you're still here, that's not the case. But anyway, I appreciate you listening to all that. And just shout out to people who do research. Like honestly, it's I've made fun of you guys in the past, like I make fun of everybody. It's always all in good fun. But what you do is so hard, and honestly, you're not rewarded like you should be. And but that's a recurring theme in this country across the board. Lots of people get rewarded, I think, for things they probably shouldn't be rewarded for, at least not as much as they are rewarded for it. And so, anyway, keep up the great work. Hopefully, I got so many ideas from just seeing the discourse after that video with regard to academics, and so there's more that's going to be coming just whenever I can find time to do it. Let's see. What are you guys talking about over here? I'm glad you guys appreciate some of this stuff. Thank you. Thank you for all the Discord. I don't even know. I barely know what I'm talking about. I don't know. I try to come up with these coherent thoughts. Anyway, hey, you guys are all over the place. I love hearing about where you're from. Where is Jonathan? You guys know where Jonathan is right now. He's in his closet. He's powered down for the night. I'm sorry. Yeah, one of these days you'll see him, but it's not today. Not today. He had a busy day today. I was in surgery this afternoon. He had a lot to do, and so he needs some rest. Let's see. Did I miss anything? Oh, April. Hi, April. All right. Would you say there's hope for someone with 20/70 vision with a previous 90% retinal tear to repair to previous vision? Doctor says I'm screwed, basically. Well, my advice to doctors out there, don't tell patients they're screwed. Hopefully they use a little bit kinder language than that. And I can't say, this is one thing I can't kind of answer things like this, really very well because it's such a patient dependent thing. I mean, the more a retina is detached, you guys don't know what the retina is. It's like the wallpaper that lines the back of your eye. You need that to be firmly attached in order to see well. And then when it's not attached, you don't see. The more of it that's detached at one time, the more difficult it can be to have it stick back down. And so it can be a lot more challenging the more of the retina that is detached. But I am not a retina specialist, so I am not going to speak on the success of surgery. Yeah. I would trust your retina specialist, though. They are wonderful doctors, and they're the ones that actually, they decided that they wanted the hardest part of ophthalmology. I went cataract surgery. I was like, get me the. I'll just do the easy stuff. All right. Sometimes it's hard, but the retina doctors they actually like, get up and like go in the middle of the night. It's ugh, I don't know. All right, Sierra de Flora, two sentences I learned when someone wants to take advantage of my kindness. No, and I will not set myself on fire to keep you warm. I like that. That's good. Honestly, you take control of your own time. Like it's okay to say no. People will get over it. People will get over it. And sometimes you have to do that for your own mental health too. Hi, James. Greetings from the Nutmeg. What is the Nutmeg State? What is that? I don't know. Where do you guys know where the Nutmeg State is? I don't know. I've never heard that. Anyway, I do enjoy doing the speaking engagements. It is picking up again. It is for during the most of the pandemic, it's been shut down. It's now coming back up. I got some really awesome things lined up. I'm excited about. I'm going to Washington D.C. in April to speak at the American Med Student Association (AMSA). I am going to an ophthalmology conference. It's called the Mid-Year Forum in April. And then I have a couple of commencement addresses for med school I'm doing. This is exciting. I'm going to the University of Colorado to give their students a commencement address and Yale Medical School. I'm going to be giving their commencement address. I'm very excited. I'm very excited about that. I love speaking at things that places where I can, it's accepted that I tell jokes. It's kind of my thing, everybody. I enjoy that. I like to hear people laugh and making people laugh, especially those in medicine. So it's very exciting. Some questions that I'll kind of try to keep an eye on the chat here. Doug, your thoughts on why the FDA approves these extended or continuous wear contacts if they're so bad? Um, I don't know the ins and outs of contact lens approvals, because it would be, for just like most things in medicine, if you abuse them, that's when you get into trouble. Now, I would never recommend anybody sleep in any contacts overnight unless there are a couple of very specific situations. And so I think it would be hard for the FDA to deny it because maybe the data shows that if you are very diligent in taking care of those contacts, then the risk is not too high for infection. But all it takes is one misstep. The contact's not clean. You have an abrasion. You get the wrong bug in there. Overnight, you develop an infection. It's just too easy. I see it too often. So I don't know. I most of the time I don't really know what the FDA is doing or what they're thinking, but that is the way it is. Good question though. So one interesting question I got on the in the community tab over there is if you something about if you're eating a bunch of carrots, do your insides really turn green? Or sorry, turn orange? If your insides, why would they turn green? What am I talking about? Do your insides see? That's what happens when I start talking about body medicine. I don't make sense. So, but if you eat enough carrots, what happens? Is that? But it actually made me think about, okay, are carrots good for the eyes? I'm sure a lot of you, we've all heard that, right? Well, yeah, yeah. Carrots are good for the eyes because they have a chemical called beta carotene. Beta carotene is your body accepts that and turns it into vitamin A, and that's really good for your eyes for two reasons. Vitamin A helps you see at night, so it's good for your photoreceptors. It's good for just a good chemical to have in your eyes. It also helps keep your eyes lubricated. I'm very much pro eyeball lubrication. And so, but you don't everything in moderation. You don't want to overload on vitamin A because that can also be very bad. There are so many things that will kill you if you eat too much of it. Things that are very benign. Like I'm sure if you eat, I'm not sure what the lethal dose is, but if you eat enough carrots, that would probably kill you too. Don't eat all those carrots. Maybe just like 3 or 4 at a time. That seems like a good amount to me. I don't know. Jay Ermagood got accepted to med school today. Congratulations. I'm so excited. Yeah, my God, I need to change this. Why do you keep saying that? How is cardiothoracic surgery? You're asking about why I portrayed cardiothoracic surgeon. I think I've only had them in one video. I have not actually, I don't think I've ever actually met a cardiothoracic surgeon. By the way, you don't have to say it like 50 times. I mean, sure, it got my attention, but let's not do that. I think I can actually prevent that from happening. Anyway, cardiothoracic surgeons, I don't know personally any cardiothoracic surgeons, but I have heard from other people that it can be a very intimidating field with lots of anger being displayed and very difficult hours, very sick patients. And if you think about it there, I mean, you're operating on the heart. There's only one of those things. If you mess up the heart, that's it. You don't have another one. Like we have two eyes. Like it gives me some comfort to know that if something happens to one eye, at least the patient has another eye. That is only one heart, as far as I know. Is that still the case? I don't know. It's been a while for me. Anyway, and so I can imagine that the stress level is significant when you're operating on a heart, and so or the thorax, the heart and that's all I know. It's cardiothoracic. You're doing heart surgery, you're doing thorax surgery, whatever that means, whatever they do. But good question. Let's see. We got a couple other things here. 5 years studying just to get into grad school for athletic training. Found out it costs $50,000. After graduating with a master's degree, only pays. Well, you know what? I'm glad to the guy hygienist. know what that means. It takes a lot of it takes a lot of courage to like get either part way or the whole way through some kind of training program or some kind of education path to and just to decide this is not what I want. This is not going to be good for me, and just nope out of there. Like that takes courage. That is really impressive to do that. And just to say, look, I this life is too short, and I want to do something else, and just cut ties with it. I think that's uh, a really admirable thing. Well done, Austin. Hi, Austin. Austin Hicken. You're a medical assistant. You work for a dermatologist. The only doctors that have better schedules than ophthalmologists. They're even the dermatologists make fun of us. They're dermatology. What an amazing field. I did a dermatology rotation in med school, and they had a very nice schedule. It's also a pretty challenging field. What they know, the types of things they have to learn, like what every single chemical in the world does to the skin. You know how many chemicals we come in contact every day? It's ridiculous. And they got to learn all those, the names of the chemicals, what they do, and also the fact that a dermatologist can look at like a red spot on like your elbow and be like, oh, look, you got hepatitis. How do they do that? It's like they all of the skin manifestations of these rare diseases. Oh, look, you got your hair, the arm hair is growing the wrong way. You got porphyria. It's a rare blood disease that there's no cure, but we diagnosed it. Like stuff like that. It's crazy. I can't believe they know so much. They're so knowledgeable, smart, and dermatologists. For some reason, they are the most beautiful people in medicine. No one, science has proven this. I'm not just making this up. I'm pretty sure this is published in Nature, probably. Clearly, the most beautiful people in medicine. I don't know. Do they become beautiful once they're already there? Is it a Can anybody answer this question for me? I don't know. But why are they all so attractive? It doesn't make any. I don't understand it. Obviously, the skin thing, but I mean, come on. I don't know. I think it's a mystery. I don't think anybody's ever going to figure that out. Let's see. I don't want to miss any of these. Let's see. We got Jaden. Any advice for future med students? 19, I graduate with my bachelor's and apply to med school. Future advice for future med students. Um, God, it's been so long since I've been in med school. I really liked going into med school with an open mind. Some people went into it knowing they wanted to be like a spine surgeon or those orthopedic surgeons. I swear they know they want to be an ortho like by the time they're like 6 or 7. Probably the first time they lifted a big wheel over their head. I don't know, but I on the other hand did not know I wanted to do ophthalmology until I was like in my 4th year of med school, and I learned that I wasn't normal. Because normal people don't devote their career to the eyeball, and so I realized that was my path, and I think it helped me in my rotations. I had a very open mind. I was like I went into every rotation. I tried to honestly to go into every rotation thinking maybe this could be the thing, and it allowed me to learn a lot, and most of which I've forgotten, but I learned it at the time. I really did. So anyway, keep an open mind. Nathan, the difference between informing a patient about cancer from dermatology versus oncology. Yeah, I can speak to this from my own cancer diagnoses. So those of you who are new here, thank you. The Glock flock is out in force today, Madeline. You're absolutely right. You guys are just great. We got 700 people here. It's still climbing up too. Um, so Nathan, that's a great question. So I'm not in oncology. I don't, but from a patient side of things, the two doctors who informed me that I had cancer. One was a um, One was a urologist who ended up doing my surgery, This is testicular cancer that I had, and it better be testicular. I don't know what other cancer a urologist is going to tell me I have. And then the other one was actually the radiologist, a radiologist, and I remember that conversation because the second cancer I had, second time I got testicular cancer was a very difficult. It was a little bit more devastating to me personally because there were a lot more you know, physical and mental things that I had to figure out. But I vividly remember the conversation I had with the radiologist, and that radiologist was so good, was such a empathetic, listened to me, answered questions. I remember that. I remember his face. I remember everything but his name, honestly. And so shout out to radiologists. People think you're not good at that part of medicine. That's the reason you went into radiology, and I don't think that's the case. And so I the radiologist told me, and it just taking the time and answering questions, asking, not giving too much information, I think is a big thing, because sometimes people are overwhelmed whenever they receive a diagnosis like that. And so being able to be supportive of that person, but either asking, what would you like to know? How much do you want to know? I think are reasonable questions to ask someone who's just been diagnosed with cancer. It's a good question. Nutmeg. Oh, here we go. James, Nutmeg State. He's back. Connecticut, you guys. Connecticut is the Nutmeg State. James, I'm gonna be honest with you, James. That is a dumb nickname. It's not great. It's there. I'm sure there are other things that Connecticut is would be better. Like what other things are you known for? Being close to New York, like there's got to be something better than that. I don't know. The fact that it's Connecticut, but it's I see. I really relate to that as an ophthalmologist because ophthalmology has a lot of extra syllables or a lot of extra consonants too. So I can appreciate the weird spelling. New Haven, a lot of cool stuff, plenty of great food. You guys shout out New Haven. It's got the best pizza in the U.S. I'm sure that's not going to cause some controversy here in the chat. Best pizza, Connecticut, New Haven, the Nutmeg State. Put a little nutmeg on your pizza. It's great. Excellent. Nutmeg pizza. Perfect. Yeah. So anyway, yeah, people are, everybody is definitely agreeing with you here. Oh yeah, somebody, what's the secret to my hair? I don't wash it like very often. Is that gross? That's probably weird, right? It's not like I don't wash it. I just don't. Whenever I wash it too much, like it gets super frizzy. So I limit the number, maybe like once or twice a week. I don't know. I don't want to I don't want all the hair people to unsubscribe. I don't even know what that means. What am I talking about? This has been going on. It's getting late. Anyway, so anyway, I actually don't put any product in my hair. I get it cut every so often, and then I just don't do much to it. I just let it be. I just let it be. Okay, anyway. That's it. Um, oh no, not the hair people. All right, and we're gonna wrap this up here in just a couple minutes. Oh, Nathan. Okay. Nathan's back again. You guys, Nathan, save some money for yourself, okay? I don't want you to go into debt from this. You're only MA. You're only an MA. Mostly deserve the moment. Telling someone they have melanoma in person is hard. Oh, Nathan, no, I was thinking you were the Connecticut guy. Never mind. So Nathan, yeah, I mean, honestly, any type of cancer, melanoma is a very difficult cancer, and we have we have had melanoma. Um, we have patients that come in with melanoma of the eye. You can get melanoma in your eye because you have pigmented tissue kind of behind the retina, and so you can get it there too. Not to scare anybody, like it's very rare. It's about like 6 to 7 cases per million people or something. So it's very, very unusual, and it depends on what location, part of the country you're in. But uh, it's always a difficult conversation to have, and so I really feel for all of you who are out there, making those difficult diagnoses, not just cancer, but anything. Those are all, as a someone who's well versed in the patient experience, it can be a very challenging thing to do, no matter what specialty you're in. We all have, pretty much everybody has those very difficult conversations from time to time. And James, we'll do a couple more here. James, you got to use the word vitreous outside the context of eyes the other day. You were teaching earth science undergrads. You teach earth science. I think that's awesome. And thank you for why. I don't know why you were using vitreous, but that's great. I'm a big fan of the crazy words we have in ophthalmology. So I encourage all of you. Your homework is to all use an ophthalmology word. It can be vitreous. It can be aqueous. It can be pseudophacodenesis. It can be glaucomflecken, which is an actual word in ophthalmology. It can be even just the iris. It can be the sclera, the optic nerve. Your task, you have to all, before next What the Hell Wednesday, you got to all use an eye term in public. All right. Even if it's embarrassing, you have to do it. All right. Or you're not invited back here. You guys keep giving me donations here. Diane, Dr. Rutkowski did good reactions. I'll have to check that out. Thank you. And Mike, thank you. Tips for eye exams. All right, that's a big. I'll talk about that next time a little bit more. But it's lots of tips for eye. It depends on what you're doing. Red flags you don't want to miss. If you put your hand in front of the patient and they can't see it, there's something wrong. That's my very quick tip for you, and I'll add that to the list of things that I can't keep up with this, you guys. This is you're being too generous. Samantha, is Jonathan. Jonathan is based on a real person. Yes, he is. Jonathan is my actual scribe. I actually have a couple scribes. And there's Luis, my loyal scribe, Luis. He was my scribe for a long time. Now he's actually becoming a technician. So he's moving on to a different role, and he's doing a fantastic job. Now Paige is my latest scribe. She may be listening and watching this, but she's also doing a fantastic job. Oh, I've just been informed that that I'm on childcare duty tonight by the sign back there. So we're going to have to wrap this up. I appreciate all of you. Okay, thank you. That's how we communicate, just by signs. I'm glad you like the neurology character. Thank you all. I have to cut this short. All right. I'm glad you guys liked it. You want to see the dog? The dog is not in here. I'll show you the dog next time. Okay. And I'm always looking for tips, things you want to talk about. Thank you all for the donations, and I'm glad you all like the content. I'm going to keep doing it until one day I just decide I'm not going to do it anymore. I don't know when that'll be, but we're going to keep it going. All right. So take care, everybody. I appreciate you being here. Happy What the Hell Thursday, and we'll do this again in a couple weeks. Okay. See ya.